All right, let's go ahead and get started. Before I introduce our guest, I'm going to go ahead and introduce myself. My name is Natalie Hazard, and I'm an intern at the University of South Carolina's Alumni Association. I do just want to give a little brief overview about Zoom, as well as thanking Prisma Health for sponsoring these events for us. They truthfully could not happen without them. So if you are not familiar with Zoom, I just wanted to let you know at the bottom, you should see a control panel down there, and you should see a Q&A tab as well as a chat tab. And throughout Ms. Korpita's section here, we ask that you guys kind of just put in questions throughout it just to keep the ball rolling. And at the end, we will do a Q&A session for everyone to be able to get their questions answered. So if you could just throughout the presentation, put your chats in there so that way we can answer all of those questions at the end. I'm going to introduce Ms. Eileen Korpita here. She directs the Office of Pre-Professional Advising at the University of South Carolina. She has been working with college students at our university for over 20 years. Eileen has a BS in education working with college students at the university. Has a BS in education from State University of New York at Cortland and a master's in public health from our university here at South Carolina. She also teaches 2 university capstone courses related to the transition into medical school. Eileen also has 2 grown daughters that still occupy a lot of her time. So with that being said, I'm going to turn it over to Ms. Korpita.
Thank you. Thank you so much. I'm happy to be here. Hopefully share some good information with everybody. As was mentioned, I work at the University of South Carolina and do most of the probably all of the health professions advising at the University of South Carolina, working with undergraduates who are interested in pursuing medical school or another health professional program, and also alumni who are interested in maybe a career change or just maybe getting started a little bit later. I'm happy to work with alumni as well at any point. So today, I'm going to give you a little bit of a background about why health professions are so popular right now. Also talk a little bit about preparing for the health professions, what kind of requirements there are for most of the programs, and briefly about the process of application. And I want to mention that the information that I'm presenting is general. So I'm happy to answer any more specific questions at the end, or also my email address is on the last slide, and I would be happy to entertain any personal emails if you want to. If you have a question, you'd like to email me and talk more directly with me about an issue, happy to help. Okay, so according to U.S. News and World Report, they always come out with their 100 top jobs every year. And this year, looking through the 50 top jobs, 31 of them are in healthcare, which is pretty amazing. Looking at the top 10, 7 of them are in healthcare. So all of those careers are growing at least as fast as average. And most are growing faster or much faster than average. And that comes from the U.S. Bureau of Labor Statistics, the Occupational Outlook Handbook. Healthcare is the fastest growing industry in the United States. And as of 2018, it was the largest employer in the country. So U.S. News and World Report bases their ratings on several different factors, and these are some of them. Pay, whether it's a challenging career requiring continuous learning and problem solving, how you can match your talents and skills to a particular career, the room to advance, work-life balance, and future demand. So the growth in healthcare really is attributed, healthcare careers is really attributed to a lot of different factors. Just go through a couple of them. First of all, the Affordable Health Care Act Affordable Care Act, sorry about that. This, of course, is in a little bit of limbo right now, but has definitely created many, many more insured people in the United States. So there definitely has been more of a demand for healthcare. Also, the focus on public health. There's really no less demand for acute care, but there's a bit of a slow but sure, hopefully, focus on public health and prevention. And basically that then requires different types of professionals. So public health educators, caseworkers, patient advocates. So it just requires another number of different professionals that will increase the number of career jobs. Also, the decreasing stigma on mental health issues. You might know that the Generation Z kids are, I say kids, are much less concerned with the mental health stigma issues. They really do have a lot of pretty significant stressors and have grown up with a lot of significant stressors. And they really happen to be acknowledging those stressors and definitely accepting them and trying to do something about it, which then is leading to an increase in mental health care professionals. Also, our aging population, we have an aging population, but also living longer than in the past. And then growth spurs growth. So the more growth there is in the need for healthcare, the more demand there is just for the infrastructure for healthcare on HR and IT and data analyzers, just all sorts of interesting things. So this is basically what I do in my job. I am, again, I'm the advisor for the health professions, and I deal mainly with students, people who are interested in medicine, allopathic and osteopathic medicine, dental medicine, veterinary, also work with students who are interested in physical therapy, physician assistant, occupational therapy, optometry, and the et cetera basically is things like speech pathology. Haven't worked a lot with that in the past, but it seems to be gaining momentum here now. Things like, let's see, speech pathology, audiology is another one that seems to, I haven't worked very much with students interested in audiology before, but again, seems to be gaining some traction. So what I do in my job basically is, first of all, I want to provide accurate information and resources. And this is something that I try to do early in a student's career, make sure that they know what they need to do in order to have a competitive application once they apply to a health professions program. And hopefully let them know where their best resources are. Of course, there are a lot of different resources, some better than others. And so I try to help them navigate that. Also, try and identify and offer beyond the classroom activities that students need that really are required for admission. So a lot of different things like community service and shadowing and engagement in student organizations. There are a lot of different things that students really need to be involved with to have a competitive application. And not just to have a competitive application, but really as a demonstration of the types of characteristics that health professional programs are looking for. And then I also help them highlight their achievements effectively. So basically that's when it comes down to the application. Things like the personal statement, things like listing your work and activities in an effective way and in a way that is compelling and also well written. So for pretty much most health professions programs, these are the things that you really need to get an interview. So it's all leading up to getting that interview when you go through the application process. And basically the things you need to really focus on are, first of all, grades. your grades over the course of the time that you're in college basically demonstrate consistency over time. Test scores, every professional program has their own standardized test score or standardized tests. So all applicants need to take those tests to sort of be able to compare to other applicants. Also need exposure to whatever profession it is that you want to get into. You need to be able to prove to an admissions committee that you know what you're getting into. You know what the profession is about, and you're ready to dig in and go through the education necessary to pursue your career. I have up here also that physician assistant, those programs are definitely require patient care hours more than any other profession. And to get into a physician assistant program, most programs require a lot of patient care hours, anywhere from 500 to multiple thousands of patient care hours. And patient care hours that are accepted at most programs are jobs where you are actually, the applicant is providing the healthcare to the patient. So a lot of things don't count, like community service in a healthcare setting, those sorts of things. Most shadowing doesn't count, although sometimes it does, but things like being a certified nursing assistant or a phlebotomist or an EMT or being another healthcare professional, those hours are going to be very important for the application process. Demonstration of core competencies. So about 6 years ago, the Association of American Medical Colleges came out with a list of core competencies that medical schools want their applicants to have. So the reason I put this in here is because the core competencies established or that are on this list are really desired by all health professional programs. So I'm going to talk a little bit about that. Although the Association of American Medical Colleges put the list together, it really it relates to all healthcare professionals and the characteristics that are looked for. Also, knowledge about the field and knowledge about specific schools. So you need to, again, know what you're getting into. Personal statement on your application is very important. It really is your first personal introduction to an admissions committee. This is the place where you can talk about why what your goals are meaningful and significant to you, why you want to do what it is you want to do, why you want to go into a PA program, why are you a qualified applicant, why do you think you'll be good at that career? So the personal statement really is the first introduction on a personal level to an admissions committee. And then there's letters of recommendation. All professional school programs look for letters of recommendation from most of the time from faculty. They could be from job supervisors, research mentors, coaches if you're an athlete. But basically your letters of recommendation are a confirmation of what you are saying about yourself from an outside source. So a little bit about course requirements. Of course, course requirements are not consistent across programs. So medical school requirements are different than dental school requirements, different from PA requirements, different from veterinary school requirements. Although there are a lot of similarities. But what is kind of frustrating is that the requirements aren't consistent within the programs. So in terms of applying to medical schools, well, the requirements for the med school in Columbia, the med school in Greenville, the med school in Charleston, they're all different. So it gets a little bit frustrating for applicants because you truly have to keep track of the requirements of every program to which you think that you might want to apply. Always lots of sciences. So regardless of any individual school's requirements, you're going to have to take a lot of sciences. And even if the sciences aren't required for a program, maybe they're just recommended, a lot of times the sciences are what will be tested on the standardized test that you're taking. So it's going to be really important that you keep track of the sciences. Other things that are important, and this sort of refers to the core competencies. it takes more than brains to be a doctor, to be a PA, to be a vet, to be a speech pathologist. You do have to be smart. Competition is fierce to get into these programs, but that's what's going to get you in the door, but that's not what's going to get you into the school. So all of these things are so important. Just being a team player, being compassionate, having confidence, being mature, being able to communicate. All of these things are going to be important for any healthcare professional program. So these are some of the core competencies. I know there's a lot on this slide, but just to give you an idea, this isn't all the competencies, but this is sort of an example of them. Things like service orientation and compassion, social skills. You know, do you have the social skills necessary to be able to relate to patients, to colleagues, to families, to lab professionals? Also, cultural competence. How familiar are you with audiences that aren't like you? Certainly, when you're a healthcare provider, you're going to come in contact with all sorts of different people, and so the more culturally competent, but the more exposure you have to different cultures is definitely going to help you. Teamwork, oral communication and written communication, reliability, dependability, resilience, all of these things, these are part, again, of those core competencies that are important for all professional programs. So I will say one more thing about the core competencies is that you need to demonstrate them. You can't just go in and say, I'm culturally competent or I'm compassionate. You need to be able to demonstrate how you have been compassionate, demonstrate that that you're a team player based on the things that you've done the past several years, in terms of being able to relate to people. You know, have you worked on committees? Have you done group projects? All sorts of different things. But you can't just go in and say, I am this characteristic. You have to have demonstrated it while you're in college or another profession. So for the application process, there's a centralized application service for each profession. So there is the American Medical College's application service, AMCAS. There's also the PTCAS, which is the Physical Therapy Centralized Application Service. There's one for every profession. So that's the application service through which you apply to your programs. It's sort of like the Common App. So you put together one application, and then the application service compiles all of your information, and then once that's done, sends it out to the schools to which you apply. So each application service has different opening dates and different deadlines, and that's something that you definitely need to be cognizant of when you're in that application process. Typically, there's a new application every year. So if you were to fill out last year's application, well, unfortunately, you're going to have to do the new application for the new year if you've done the old one accidentally. So each year, there's typically a new application for each profession, and they have a specific date where you can submit, and then deadlines. And deadlines differ by programs. There are some application services where there's only one deadline for all the programs, but most of them, each program, each school has its own deadline, and you have to be able to follow those closely. You also will have to provide supporting documentation. So this will be things like transcripts, letters of recommendation, standardized test scores, those sorts of things that are supporting your application that you submit. Typically, after you have submitted an application, schools have a specific secondary or supplemental application, and that's specific to each school. So your original application goes to all the programs to which you apply, and then each individual school that wants more information about you will send you a supplemental application. And again, that's specific to the school. So they might ask you why you're interested in that particular school. What programs do they offer that draw your attention? Those sorts of things. What are your practice goals? Different things like that. And some of them even ask ethical questions that you have to write essays about. So then comes the big the big interview, and of course we're all trying to get to that interview. Typically, when you get to an interview, that means that the school thinks you can do the work. So you can do the work, you have support from your letter writers, you have a strong transcript, you have decent test scores, you have talked about the characteristics that you've demonstrated throughout college or throughout your preparation for your application. So now, are you a good fit for that program? So getting to the interview is definitely a big step, one that you can certainly be proud of. Basically saying, yeah, you can do this. Now, do we want you at our program? And do you want us? Are we a good fit for you? So the interview is really a two-way street. And then after the interview, you get a response. It's either going to be yay, nay, or maybe. So frequently you'll get information shortly after the interview inviting you to accept one of their spots. Some people will get a letter saying that you're not going to be further considered and you won't be accepted this year. And then a lot of people will be put in a maybe pile. And basically what that means is we're not accepting you right now, but we're not ready to give you up yet. We want to see who else is coming with applications and interviews down the road. And we're going to relook at your application along the way. So I work with a lot of career changers, people who work in totally different jobs. I've worked with accountants who want to be more fulfilled in their careers. So a lot of career changers that I work with are seeking personal fulfillment. They want to be able to go home and feel like they've made a difference in other people's lives. Nice thing about career changers is all of the things that typically people in other careers, the characteristics that they've developed typically are characteristics that health professional schools are looking for. Especially things like maturity and life goals and being goal oriented. Those sorts of things come more with experience and age and wisdom. So health professional programs really do look quite highly on non-traditional applicants or applicants that maybe are changing careers. Another thing is the COVID-19 pandemic, as difficult as it's been, it's also really shined a light on healthcare workers. We see that healthcare workers are selfless and trusted and admired, and a lot of people want to be part of that. And so just the light that has been shined on healthcare workers during the pandemic, I think has encouraged a lot of people to want to go into healthcare. And there are different, certainly widely variable education and skill levels for different professions across the board in the healthcare industry. So COVID has had definitely an impact on students who are applying for healthcare professions. First of all, for an entire year, there's been very little opportunity for healthcare exposure. And that might be shadowing, where you are actually observing a professional in the career that you want to go into. And also even community service in a healthcare setting has been difficult to get. So what that means is that for an entire year, students who want to be getting this healthcare exposure, so they can reassure themselves that, yes, this is what I want to do, and they can prove to an admissions committee that, yes, I know what I'm getting into. It just hasn't been around for a year. So it's been very difficult. Other things like online learning. I work with a lot of students. Some students have had an easy time switching to online learning. It hasn't been too detrimental to their learning. Other students have had a really difficult time. They much prefer being in a class, listening to a professor, being able to ask questions, that sort of thing. So a lot of students have definitely seen a dip in their grades, a dip in their learning processes. So definitely online classes have had an impact on students. Another thing is limited interaction with professors. Now, if you go to office hours of a professor, there might be 25 people because it's virtual. So there might be 25 other students in that office hour. So it's really difficult to get to know a professor. It's difficult to get your questions answered, more difficult to get your questions answered. So that also has taken a toll, especially when it comes to letters of recommendation. Typically you want to get letters of recommendation from professors or people who know you well and can confirm the things that you've said about yourself in terms of being a team player or having leadership skills or being intellectually curious or being dependable. But when you can't get those interactions with professors, it's pretty tough to get a letter that confirms those traits. So I know a lot of students are struggling with that right now. And then there've been a lot of changes in grade requirements. Pass-fail courses have been accepted by health professional programs more so than ever before, even for required courses, which typically is unheard of. And also standardized tests. A lot of them were canceled at the beginning of last year and actually through the beginning of the summer. Tests were canceled, were rescheduled, which I think definitely is hard on the applicant. It's stressful enough to have to take the test, but then when it's canceled and rescheduled and canceled and rescheduled, it definitely takes a toll. So that has been difficult. There are even some health professional schools, some programs that have abandoned the use of standardized tests for the year, which I'm sure students don't mind hearing. And then for resources, these are some of the best places to go. The website explorehealthcareers.org is a fabulous website that has information about, I would say, just about every healthcare profession that you could imagine. And it gives you a lot of information about each healthcare career. It tells you about the education that you need, tells you about the job outlook, average salary, working conditions, and it also gives you resources. It will tell you where that centralized application service is, or where the National Association is to get your questions answered, those sorts of things. So that's a really comprehensive informational website that if you're interested in healthcare, but you're not sure what type of healthcare, that's a great resource. And then, of course, the government sites. The Occupational Outlook Handbook is very helpful. The Bureau of Labor Statistics gives you more information than you ever did want to know about the economics and different things related to careers and professions. So again, I'm Eileen Korpita, happy to help in any way that I can. I'm happy to answer questions now. I'm also happy to meet with anyone virtually that has a question they'd like to talk about. So I guess I will let the questions begin.
Yeah, so if you guys want to go ahead and put in either in the chat or in the Q&A any questions, we've got some time to have Ms. Korpita answer those. So we have a question, and it is, what are your tips for working alumni who may want to go to medical school?
Well, that's a good question. And I have worked with a number of people who are involved in another career who want to change careers or go to medical school. First of all, you have to make sure that you know what you're getting into. You have to know what you're getting into. And typically, if someone is eager to change from one career to go to medical school, they have a good reason, and they do know what they're getting into. You really need to begin by looking at the requirements for medical schools, the types of courses that you need, the types of standardized tests that you'll have to take, and what each medical school that you're interested in. What are you interested in a medical school? Are you interested in a medical school that focuses on clinicians, focuses on training doctors to work with patients, or are you more interested in research? So really, it's a matter of starting to look at things that medical schools are requiring, courses, standardized tests. And I would say also try and interview either some non-traditional students who are in medical school now, who maybe did change their career, and certainly interview physicians. But I think that would be a really good place to start.
Awesome. So we have another question. Ms. Cassidy is currently a public health BA major with a minor in Spanish, taking the BA route, focusing more on the social side of things. Therefore, have you had experience with individuals who want to help individuals and make an impact in the medical field, even if they are on the Bachelor's of Art route?
Well, certainly there are ways that you can make a big difference with the Bachelor of Art route. Typically, you don't take quite as many sciences going that way. But there are a lot of things you can still pursue. So I work mostly with people who are going to be providers of healthcare. And typically there are a lot of sciences. But when you look at a lot of public health careers, a lot of them are community focused, education focused. And certainly a BA is more theoretical and conceptual than the BS. And so certainly that puts you in a good place to work in health education, or work in safety education, work in clinics, that sort of thing as an educator. There are a lot of different things you can do, especially in public health with a BA.
Awesome. So our next question is, what is one way to stand out virtually, either in the application process or in the interview process?
I think to stand out when everything is virtual, you have to make sure, first of all, that you're technically doing the things you need to do. And that's things as simple as making sure that your computer is at eye level when you're involved in an interview, making sure that the background is not too busy so it's not distracting. Even just those practical things are important. I've seen dressing professionally, dressing professionally from top to bottom, not just on the top with your pajama bottoms on the bottom. Dress professionally. The more you feel like you're being professional, the more professional you're likely to act. So even just things like that. In terms of getting to know professors better, it's difficult. It's very difficult, but I think that you do need to continue to go to drop-in hours, whether there are 2 or 25 other students in there. Continue to go where you're being seen, your name is being seen. You can ask questions. You might not be able to ask a lot of questions, but you can ask questions. Use email as well. There's certainly nothing inappropriate about emailing a professor to see if you could set up a time where you could meet one-on-one with the professor. They may say yes, they may not say yes, but it definitely is worth a try.
Awesome. So the next question is, the entire process of applying to med school seems very overwhelming. So where do you personally recommend starting?
So it is overwhelming, but you have to start somewhere, right? So really you need to probably look at a timeline. It really depends if you are a college student, a first-year college student, or a third-year college student, or a career changer. But basically it's looking at a timeline and figuring out, okay, if I want to start medical school this summer, then how do I put everything in order? So you need to realize that typically you apply to medical school a year before you want to start. You typically take the MCAT at the same time. So that means if you want to start medical school in 2024, it's the summer of 2023 where you're actually taking the MCAT and applying to medical school. Working backwards, that means that you have to have already taken all of the courses that are tested on the MCAT, because you'll be taking the MCAT at that time. So you have to figure out, okay, so how am I going to fit all these courses in before I take the MCAT? So sometimes it's a matter of really working backwards. It is overwhelming, but it's doable. It really is. It sounds like a lot, but you don't do it all at the same time. You really can create a plan. And I think that's probably the most important thing, is creating your own timeline, creating a plan so that you can do it step by step.
And our last question so far is, how will medical schools treat virtual shadowing, since shadowing opportunities are limited during the pandemic?
So first of all, medical schools definitely realize that there's been no shadowing. That's something that they're not going to hold against any applicant. They realize there hasn't been any opportunity. And it depends on what you mean by virtual shadowing. The reason for shadowing is so that you can observe, if we're talking about medical school, doctors working with patients. So it's really being in an exam room, watching the interaction between the doctor and the patient, watching, seeing how patients react to doctors, realizing that when a doctor is working with a sick patient, it's not always a great interaction, because the patient is sick, so the patient doesn't feel good. So it's getting an idea of all those different relationships and interactions that the doctor has with the patient. So when you talk about virtual shadowing, most of the virtual shadowing that I have seen has been more interviews with different healthcare professionals, which isn't a bad thing. There's nothing wrong. I mean, if you're learning about your intended profession, that's great. But it isn't necessarily shadowing in the true sense, where you are observing a doctor working with a patient in an exam room. Again, I would still do it. I would still do the virtual shadowing. Now, I have heard of some true virtual shadowing through dentists, where they aren't subject to the same confidentiality, liability issues that most physicians are. And so I have seen some virtual shadowing where dentists actually wear a camera on their head and they will narrate what they're doing and what's going on. That's virtual shadowing, where you really are seeing it all. But just understand that the whole reason for shadowing, per se, shadowing, is so that you can get an idea about that doctor-patient relationship. You can see what it's like to be a doctor working with a patient, having to change the way you communicate to different types of people, having to being able to build rapport with a patient, all those things that are so important.
Awesome. It does look like that was our last question. So we'll give you guys just a few more minutes if you have any other questions that you want to type in the chat. Ms. Korpita's email is here, and I have personally worked with her, so I do know that she knows what she's talking about and is willing to help. So if you guys do not have any more questions, though, feel free to leave the chat. And thank you all so much for attending. Thank you as well, Ms. Korpita, for all your helpful information.
Thank you for having me. I enjoyed it.
All right, awesome. Thank you, Ms. Korpita, again. I will talk to you soon. Goodbye.
Thank you for all of your help with this.
No problem. Have a great day.
Bye-bye.